Selection for SuperPath is actually really simple. I do every single hip case that I have, starting with SuperPath. The very nice thing about it is easily extensile, but I will go one step further than that. The best thing about it is that when you extend the excision for SuperPath, you're actually doing so from the inside out. So you can create an easy posterior approach from the inside of the hip, and that leaves all of the rotators and the capsule completely intact together as one big flap. And so you create a very large flap with all of your soft tissue with the posterior approach. It's probably one of the cleanest posterior approaches that I've been able to do in my hands. So even if I think to myself, oh, I'm going to definitely need to do this posteriorly, I start at SuperPath and then I extend it to a posterior approach, and it's a better posterior approach than I'm able to do from the outside in. That's very nice because what I've found is that approaching every case by SuperPath, I'm able to do much more with much less dissection than I realized I thought I would have to in the past.
The only people I don't do SuperPath on are those that have extreme deformity. So I'll do this on hip dysplasia patients. I'll do this on patients with abnormally shaped sockets. There are certain anatomy variants that are more complicated than others, but it's a really rare patient, maybe one a year, where I can't do the SuperPath with this. And you can even do some straightforward revisions through the SuperPath as well. You start with the SuperPath basic approach, and if you need a little bit more, you can go a little bit further. If you need a little bit more exposure, you can do a little bit more of a release. And because you take this stepwise approach to the soft tissue releases that you might be doing to make the procedure more safely performed, you're not just immediately just blazing a fire through there and opening up this gigantic wound. And so I still see a significant benefit in my revision patients that the SuperPath, I guess, mentality really allows you to achieve.
I don't have any specific selection criteria that differs from the traditional hip approach, traditional hip techniques. So if a patient is suitable as far as their medical conditions and their medical comorbidities, the SuperPath technique is just as applicable to the patient that would be suited for a standard hip replacement.
My selection process for SuperPath is pretty simple. Everybody's a candidate. There are patients that if they're morbidly obese, we do counsel them about weight loss. Some other obvious issues, patients are chronic smokers, we advise them about that. So if there's any health considerations, we do have to take that into account. But on patients that would be a candidate for a hip arthroplasty at baseline, the SuperPath is available for anybody. Even if patients are a little bit overweight, I found that those patients would never have been a candidate for an anterior approach. And with a traditional standard posterior approach, just maneuvering the soft tissues and dislocating the leg with that, with the soft tissue in the way like that, would create a lot of problems for those patients. Where with SuperPath, I can actually do the procedure on somebody that's a little bit more overweight and still get the same angles, the same stability, and the same level of satisfaction.